Hey everyone, I'm here today to speak to you about teen pregnancy and to support the idea of giving birth control to your teenager. I know it's an emotional topic and every parent will have their own ideas on the subject, so I want to talk about the advantages and disadvantages and why I feel it's the parent's responsibility and the correct decision to give sexually active teenagers birth control. The obvious choice in this situation is abstinence. This is something every parent, teacher, clergy, and anyone else that shapes their children's lives should be teaching. I'm a firm supporter of abstinence because it's 100% effective. But I was a teenager and I know this approach is only as good as the teenager's willpower. This is the main reason why parents should make birth control available to their children and possibly prevent pregnancy and sexually transmitted diseases. The first advantage I'm going to discuss is the prevention of sexually transmitted disease, or STDs. Several examples are HIV, syphilis, gonorrhea, and herpes. The most prevalent STDs are human papillomavirus and chlamydia. Some others, such as herpes, HIV, and AIDS, can't be cured and even lead to death. According to the U.S. government's Office of Public Health and Science website, forparents.gov, there are 19 million new cases of STDs reported each year, and 50% of those affected are between the ages of 15 and 24. In addition, the site reports another alarming stat about teenagers. 47% of high school students have had intercourse. So the obvious choice is to make your child aware of the dangers of STDs and to give them the protection that may save their lives, a condom. The other obvious advantage is the prevention of pregnancy. Let's face it, it's the main reason parents should think about giving their teens birth control. These pregnancies not only affect the teen parents and baby, but also their families, and even reaches out to all of society. First of all, teen pregnancy has a direct effect on the new parents. Their education, income, and social interaction are impacted and may never rebound. An internet marketer and expert, Abhishek Argyewal, reveals in an article about the traumatic effects of teenage pregnancy that teen mothers will find it very difficult to complete high school and that 41% will never even graduate. Argyewal goes on to explain that the lack of education hinders the chance of landing a job position that will support a single parent and a child, and eventually these teens could end up on public assistance and welfare. Secondly, and the most startling about teen pregnancy is the way a new baby can be negatively affected. Information from a physician-developed website, womenshealthchannel.com, shows that teenage mothers probably won't seek out the necessary prenatal care that is essential for fetuses or the expectant mother. The site also shows evidence that health of the fetus is affected by the fact that teens are more likely to smoke, drink, or take drugs. Also, the families of both the teen mother and the teen father will feel the effects of the pregnancy. Some consequences may be pleasant, yet some will be life-changing. Of course, there will be times when all else is forgotten and the new baby will bring great joy into everybody's life. But these families will have to endure being outcast from their personal lives, friends, and communities. Other concerns families of a teenage mother will be faced with is the financial costs of raising a child and the actual caregiving involved. Both of these issues will have a dramatic effect on the family dynamics. And finally, the teen pregnancy, believe it or not, has a direct effect on the entire society. Statistics from womenshealthchannel.com report that teen pregnancy in the United States creates an undue burden on society that costs an estimated $7 billion a year. Some of these burdens are lost tax revenues, public assistance, child health care, foster care, and the possible involvement of the criminal justice system. Why subject their children to these life-changing risks if they could be easily prevented? Some parents may disagree with this forward type of thinking because of their religious beliefs. See what I mean? You're always being interrupted right when you're trying to do your homework. So some parents may disagree with this type of forward thinking because of their religious beliefs, the way they were raised, or because they don't think it could happen to them. As parents, we hope we have taught our children well and instilled good values that will help them in making smart decisions. But I myself feel the best approach would be to simply supply birth control to teens in order to help them stay healthy, receive a good education, and become a productive citizen in the community. I'm going to close with one last question that could be life-changing. If and when you become a parent, will you be able to make the responsible decision of giving your teenager birth control?